Your data, which you presented, refer to developed societies. You showed data from the US, from your hometown, where Bill Gates lives and you are living. That neighborhood is very important in terms of obesity. How comes?
We believe that where you live and who you are shapes your behaviors and food choices, so that any one food, any one drink, any one beverage, any one ingredient are actually less important than where you live and who you are. So that the responsibility for obesity really falls on the whole lifestyle and not on any one food.
So this has to do with income or the prices of the homes, or what is the best indicator?
Income and price of the home are just two indicators of social standing and social class. And connected to those are issues about attitudes and wanting the diet to be healthy, and education and food choices and supermarket choices. There are many, many things that come into this. There's another way of saying that when we look at obesity, we should start looking beyond food, and we have to start looking at areas where people live, what they do, how they travel to work, where they commute, where their children go to school, because all of those factors are going to be very important and very telling. And we have over-focused on, for example, a given food, saying if this food went away, all would be well.
The diet quality, is it also a good predictor of obesity?
Actually, surprisingly poor in our study. We found that other predictors were better. Diet quality was not up to the task. The problem is that the measures of diet quality are not as good as the other measures we now have.
So tell us, what is a poor quality diet?
A poor quality diet will be a low-cost diet that's energy dense and nutrient poor, and you have grains, carbohydrates, pasta, rice, noodles, low-cost foods, and sometimes a lot of added sugar, vegetable oils, and added sodium, as opposed to lean meats, whole grains, vegetables, and fruit. Those are the hallmarks of a good diet in the United States.
But the diet quality is a poorer predictor than the environment?
Yes. In our study, we measured diet quality in a number of ways. We ask people food records for 2 or 3 days. So we ask for a telephone recall of everything they ate. We also give them a food frequency questionnaire. There are a number of problems that everyone knows about with diet intake measures. People underreport, they forget, they misreport, and there's an issue with the quality of the diet reporting, not just in our study, in every study. And so the measures of diet quality based on those recalls are not the best.
So what you are saying is, it's not what you eat this makes you obese or not obese, it's where you live. Would you agree on that?
I'm saying that where you live and what you do and who you are is going to be more important whether or not you have an ice cream today or not.
And now a last word on emerging societies. Let's go to Delhi or Mumbai. The same conditions apply?
No, that's a very interesting point. What we are finding in developing societies, it is going to be the relatively affluent groups in urban centers who are becoming overweight and obese. And that will go for China, Vietnam, parts of India, and so on. But at a certain point, it flips. So then in places like Brazil, it's already going to be the poor in Rio and Sao Paulo who are becoming obese. And of course, in the United States, United Kingdom, and France, it's going to be urban poor living in Paris, New York, London.
So there's a national threshold level of income,
yes.
and then it turns around.
Yes, it is. Yeah.
Okay.
There's very interesting work by Carlos Monteiro from the University of Sao Paulo of Brazil showing the flip.
Okay.
In both cases, I should mention that in both cases, it is the women. It is the women whose weight goes up as the society becomes richer, and it is women whose weight stays up as their neighborhoods become poor.
So, but women are also important for shopping. So it's the women and the neighborhood, right?
women's weight is more closely linked to socioeconomic status than men's. Men escape to some extent, women do not. So to some extent, obesity, I view obesity as a women's health problem, and perhaps it ought to be approached as such.
Okay, thank you very much.
You're welcome.